Hello and welcome. Welcome to Diverse Conversations. This is Aska Patel. Thank you very much for joining me as we continue in our journey exploring sustainability in healthcare. Today, in our episode 2 of the series, we will be speaking with two incredible healthcare leaders and clinicians who are leading charge in achieving sustainability within healthcare organizations. It is my immense pleasure to welcome our guests for today, Dr. Danette Beechinor and Dr. Myles Sergeant. Danette requires no introduction as I have known her since my pharmacy school days. I had the honor of being her student during pharmacy school, and an incredible teacher who has definitely allowed me to, question the why and also make sure that, we always challenge ourselves to learn more. Danette is an experienced pharmacy professional, a pharmacist, and a celebrated healthcare leader who currently holds the title of Director of Pharmacy at Sunnybrook Health Sciences, amongst the various other hats that she wears in terms within organization and also outside of the organization. Danette and Myles have worked together and have interacted at various intersections, especially when it comes to exploring sustainability in healthcare, and are both co-leading some incredible work in de-prescribing and minimizing impact of healthcare organizations on the environment. Dr. Myles Sergeant is a family physician who has worked with vulnerable populations, including people experiencing homelessness and or addictions, and the elderly over the past 25 years. Recognizing the intersection between environmental issues and health, he's dedicated to addressing climate change issues and has co-founded partnerships for environmental action by clinicians and communities for health care facilities, the Trees for charity called Trees for Hamilton in 2012, and a not-for-profit shelter health network in 2005. He was recently appointed as the Executive Director for the Canadian Coalition for Green Healthcare. It is the largest Canadian green healthcare organization, which strives to build capacities and capabilities in individuals and organizations to enable the development of green health policies and practices to achieve an environmentally sustainable, climate-resilient, and net zero Canadian health system. It is my immense pleasure to have this conversation with these two industry leaders, and I can't wait to unpack a lot about the work that they're leading respectively and together and share those insights with you. So stay tuned. All right, so now I have Dr. Myles Sergeant joining us along with Dr. Danette Beechinor. Thank you very much to the both of you for taking this time out to have this conversation with me. I know you're both leading some incredible work, through the initiatives and through the organizations that you currently work for. And I'm really excited to kind of dig deep into it because, we don't hear much about this, right? Where in terms of how healthcare organizations are leading sustainable initiatives or how clinicians are leading these initiatives. So maybe we'll start off with that, tell us a little bit about your journey, which led you to the path that you're on today and, to the work that you're doing today. I guess I'll start with Dr. Beechinor.
Oh, okay. I thought you were going to start with so you can call me Danette, and please feel free to do so. And it's actually Beechinor.
Oh, I'm sorry.
No, that's okay. So yeah, what got me started on this journey? So I work at Sunnybrook Health Sciences Center, and it is one of our priorities at Sunnybrook to work towards greener healthcare. And I guess it started for me the way it started for a lot of hospital pharmacists, which is sort of two main prongs. So one is looking at sustainable meter dose inhalers and what our organizations can do there, and with respect to formulary updates and additions and substitutions in order to ensure that we have the options on our hospital formulary for the most sustainable and most appropriate for all of our patients. And then the other piece is around desflurane in the operating room. And we know that that's a very harmful greenhouse gas. And working with anesthesia groups with respect to having that removed from our formulary at Sunnybrook. It was determined that it really was not absolutely necessary, and
Right.
we could still care for patients without using desflurane, which is a very harmful gas. So I think that was sort of the tip of the iceberg. And then once you start and you peel back one layer after another, it's really like an onion, and you start to see more and more things, and you start to look for more opportunities and challenges associated with more sustainable healthcare, particularly in my case, focused on pharmaceuticals. But yeah.
That's amazing. Thank you very much. And Dr. Sergeant.
Again, call me Myles. And yeah, it's been a long journey for me, because I actually grew up in a family. This was very important to my parents, and so I suppose the apple doesn't fall far from the tree. So I started a tree charity 12, 13 years ago in Hamilton. We plant trees at health facilities for the benefits of trees for human health, and also for the benefits to the planet. And we bring medical students and residents out with us to plant. So that's been going on for quite a while. And then we were just starting to make that a provincial project. And I told a colleague of mine that, I was going to have an empty nest and I had more time for this kind of thing. And she suggested I start an initiative around making healthcare more sustainable in Ontario. So that was Peach Health Ontario, which a few of us started about, almost 2 years ago now.
Wow.
Partnerships for environmental action by clinicians and communities for health facilities. When we started that, of course, we were interested in clinics and long-term care and hospitals. And just by luck, looking around at all the different boards and people on different boards in Ontario, there was someone I knew on a long-term care board, a significant person. And I reached out to her, and she loved the idea for, making long-term care more sustainable, and like the wellness aspect of it. That's a big part of it, right? It's the whole wellness aspect for people participating in this. And then wave 4 hit, COVID. And so then she said, look, I'm sorry, Myles, we're going to have to, put this on the back burner. And that's actually what led us to doing most of our work early on with hospitals. And that's likely how I met Danette.
That's amazing.
That's my intro. Yeah.
Thank you. Thank you very much for sharing that. Like you both have such, different starting points in terms of your journey into, to kind of be where you are today. But it's amazing how the paths collide. And I guess when you're working towards the same mission, you're bound to run into folks who share the same passion. And I guess speaking of that passion, I guess maybe we can start off with that is, what are some projects that you are working together on, and, and maybe that will kind of help us understand, where we go next with this conversation.
Do you want to start, Myles? Or
yeah. Sure. There has been a number of intersections I've had with Danette. I mean, Sunnybrook's obviously a very key hospital, and they're a big hospital, well-known hospital. They've been interested in this sort of thing for quite a while. I think Danette could say more, but in terms of their corporate strategy, it seems to me it's been about a year and a half that they've had this, I forget what it's called, the President's Committee on, their corporate green team, let's just call it that. There was another group I was working with on the low-hanging peach tree, the low-hanging knowledge tree that you've probably seen. And that group put a lot of work into thinking through what the various low-hanging peaches are, which initiatives you should take at your facility to get the biggest bang for your buck, right? What are the big greenhouse gas containing things that you can take on? And certainly pharmacy was involved. So I know I picked Danette's brain about that quite a bit. And then about, is it 6 months or so ago now, I'll leave this story for Danette. Danette said, hey, there's another peach on the tree you might have missed. And I've yet to add it, Danette. I still need to do that. But that was a very interesting one. Of all the peaches on the tree, a couple of them, one of them is deprescribing, which for a 200-bed hospital, deprescribing by 5%, that's only 1 out of 20 meds, saves $200,000 to $300,000, and is one of the big fruits on the tree, in that it contains more than 100 tons of CO2 per year.
Wow.
So I guess backing up a step, pharmaceuticals are over 25% of the carbon footprint of healthcare. So I'll pass it over to Danette in terms of the Sunnybrook stuff and their discovery 6 months ago.
Yeah, so certainly not a discovery, but I guess we discovered the good work that other people had done. Would be more accurate to say. So I'm one of the co-chairs with Eric Cohen on the President's Sustainability Task Force for one of the working groups. So the working group I'm on is clinical operations.
Okay.
And so what we did is we developed a matrix, like a decision matrix, where we looked at what were some of the options that we could tackle.
Mm-hmm.
What would the impact of it be? What would the financial impact be? What would be the environmental impact be? And then the other thing we looked at was how easy would it be to do?
Right.
And I think feasibility is a really big piece.
Yes.
And so if you're going to do something, so for example, when you look at the removal of desflurane from the formulary at a hospital, that's actually really easy to do. Because once it's done, you don't need to change the prescribing habits of 40 anesthetists. Right. It's not available. And so from a systems-based perspective, it's a very strong lever. When you look at something like inhalers, in order to really move the needle on the inhalers, you need to change the behavior of many different prescribers. You need to convince them that they need to have a conversation with patients who are already on inhalers. And then they need to convince those patients that they are willing to try a change for something which might be an equally appropriate, efficacious, but more environmentally friendly option. Right. And so that's really hard. It has big impact, but it's really hard. So what we decided we would tackle, because we looked at multiple options, and really all of us came together as a group and said, what did you find when you were looking? What did other people do? Let's not reinvent the wheel. And what we found was that there's a project in the UK, and it's called Nix the Nitrous is the hashtag for it. And the other piece, it's called the Nitrous Oxide Project, though. Okay. And it looks at reducing nitrous oxide waste. So not nitrous oxide clinical usage, because nitrous oxide does still have an appropriate clinical use in certain situations. Right. But nitrous oxide is often pumped through large systems in hospitals. And those systems are aging and they're prone to leaking. And so finding all of those leaks and sealing all of those leaks is somewhat challenging. Right. But we decided that if we could fix our nitrous oxide system, and we're still on that journey, we have not yet arrived, but if we can fix our nitrous oxide system, once it's fixed and we reduce the waste, it'll be easy because we will have fixed a system versus attempting to change the behavior of many individuals. So that's what we're working on now, is the nitrous oxide project. So I think I emailed now, all excited. I got one. Yeah, right. But no, it was somewhat surprising because we looked at our nitrous oxide purchases. And so anecdotally, we would speak to the clinicians who would say, oh, nitrous oxide, I used it once, like 4 months ago, in a particular instance where it was appropriate. Yet we have a 5,000 kilogram tank outside of our hospital, a bulk tank, and many hospitals have this. And our nitrous oxide usage in terms of what we purchased, which is really, that's your best way to figure out how much nitrous oxide you used and how much did you buy. Right. So our nitrous oxide usage and what folks were reporting anecdotally that they were using, there was a big mismatch. So we then decided to measure our nitrous oxide as well. So we can get to that a little bit further on if you want.
Yeah, for sure. No, that's amazing. But it's incredible to hear that, you call them the low-hanging fruits, really. But, for somebody like myself who is just getting her feet wet into this whole area of sustainability, that in itself is such an eye-opening thing for me. It's like, wow, I did not think of nitrous oxide being used for other reasons other than the clinical reasons that we were talking about, and also the impact that it would have, let's say, on greenhouse emissions and the climate change and sustainability. I guess, just to kind of take a back foot and understand that better is, why is sustainability so important? And as healthcare professionals that we are at this table today, what is the cost for not choosing sustainability from a healthcare organization's perspective?
Well, so we need to talk about climate change. I don't know how deep you want to go, but
Well,
climate change, which really is, to me, analogous with global warming, and that word was changed. The idea that there are what are called greenhouse gases. CO2 is maybe one of the most common, and methane is another one. So usually things are put in terms of CO2 equivalents. Everything's kind of put. So desflurane, which Danette mentioned, 2,200 times worse than CO2 as a greenhouse gas. So that's why it's so significant. And so the point is, there are other gases which anesthetists can use, which are not nearly as bad, right? Nitrous oxide, forgetting off the top of my head, is it 50? Is it 100 times worse? I can't remember.
Yeah. So
what is it?
298 times worse.
Okay, yeah.
And it persists in the atmosphere for 114 years, which means that a baby born today, if nitrous oxide is used during the birth, then the environmental impact will still be felt at their death.
Wow.
Right? 114 years. So it's very persistent. It's 300 times worse than carbon dioxide. So it is, and it's large volume, right? So desflurane is very bad. I don't remember the exact number. I'll trust you on that one, Myles, because I've been focusing on nitrous oxide. But but nitrous oxide comes in a little bottle, whereas desflurane comes in a little bottle, whereas nitrous oxide comes in a very large tank.
Yes.
And so therein lies part of the problem with nitrous oxide is the sheer volume. And so it is responsible for about 75% of the greenhouse gas emissions from operating rooms globally.
Wow. Thank you very much for sharing that. I mean, that was like a aha moment, because to be honest, I did not know that, CO2 emissions are usually the most commonly talked about. So it's a lingo that, somebody who's not in the space or has much awareness or knowledge about it would not necessarily have even realized that, there's these other gases which actually have a lot more impact. They're a lot more in terms of, they stick around in the environment for so much longer, almost longer than the human lifespan, I would say, an average human lifespan that we know of today. This is incredible work. And so, you've already kind of spoken about some of the work that you're leading in respectively and also collaboratively together. If you were, I know you shared a little bit in terms of the statistics, but would there be any other programs or impacts that you would like to share in terms of what your work has been able to achieve so far? And I'll start with you, Myles.
I think about this sometimes. An analogy is some of the big tree planting groups. I think there's one in New York City. Will have one of those things on their website, just kind of like a little counter, tick, tick, tick. They've planted, 1,100,000 trees, and you can look at it 2:00 in the morning. It's still ticking. I don't know who's planning at 2 a.m. But sometimes I wish that you could figure out how much impact your organization's actually having, and sometimes it's hard to measure that. Especially, it might be more easy for Sunnybrook to say these were our greenhouse gas equivalents in 2010, and this is where we think we are now. For groups like PEACH or the Canadian Coalition for Green Healthcare, where we are making resources for people, and I don't always know who reads those resources, right? And we do, I would say, consultations. I talk to MAC committees of hospitals about how they can incorporate green practices and do things like Sunnybrook is doing. How much impact does that have? I would think it has a lot of impact. And so the coalition does offer those kinds of, I would say, consulting services, not just to, hospitals and clinics, but also to provincial groups as well.
Right.
So unfortunately, really, really hard to measure. I don't I met someone yesterday from New Brunswick who said that she'd sent out some of our videos to her staff, and I didn't even find out which video it was or how many staff members got it. But yeah, hopefully, and sorry, going back, the whole thing about global warming, it is confusing, and I imagine we're making some assumptions here as we're talking away. There are a number of environmental problems for the planet. You can Google them, of course, top 10 environmental problems for the planet, and you'll see the top 10 list, and it's invariably pretty much the same. And it'll include things like acidification of the ocean and ozone layer and pollution, biodiversity loss. And one of those is climate change or global warming. The reason I picked that one is because all of them are important. I have this slide I show the medical students where it lists all 10, and it puts in red beside the definitions of the other ones where global warming kind of fits in, because it does overlap with a lot of the other ones, right? And it is the one that is considered arguably more of an emergency than some of the others. This whole idea of trying to get to carbon zero, which is like, CO2 emission zero by 2050.
Yes.
But that's an area that's where we are right now in the world, and then we're going down like this. And the reason it comes down in a curve is because it's an area under the curve situation, and we need to get down 50% within the next 7 years, which is a big task. There are reasons I think that we can actually do this. And anyway, so I picked climate change as the big one because it is so important, and obviously I'm passionate about it. And the other one that I've picked is biodiversity because I love the tree planting stuff. So I've gone on a little bit of a tangent there just to do some background.
No, that's very helpful. Thank you.
Pass it over to Danette to tell us how she personally counts her carbon impact.
I agree with Myles that it's very difficult to measure the influence that the Canadian Coalition for Green Healthcare and Peach have had. Yet that influence has been exceedingly strong. So I know that it has affected a lot of people's perspective, and it is very important. And the fact is that organizations can't have impact if they don't have the tools and the support. And it's very difficult to redo the work continuously. So it's very important to have these forums where we can share the work, like Peach, or like the nitrous oxide project in NHS, where realistically we're going and we're taking their templates and we're applying them at Sunnybrook because they were so valuable and so useful. And the planet doesn't have time for me to refigure this out, and when someone has done an amazing job already. So what Peach and these other organizations contribute is exceedingly valuable. I guess in terms of the ways that we are actually able to measure our climate impact, though, so we are able to measure when we switch from desflurane to sevoflurane, we can actually measure what the difference was in terms of our climate impact. Now, desflurane had never been our chief or primary anesthetic gas, but we do know that when we switched, we had an impact. I don't have the number off the top of my head, but I'm capable of measuring that. We were also able to, because Sunnybrook is a veterans hospital and we have long-term care patients, we were able to measure how many fewer metered dose inhalers we were using and what that impact would be. And the last time I measured, which was, I think, 1.5 years or almost 2 years ago, it was something like 10 car trips across Canada. So we were able to sort of convert it into CO2 equivalents. And the Environmental Protections Agency, the EPA, has a really great website where you can take your gases or your contributions or what you've changed or or the bad things you're doing and actually convert it into things that really help people understand. So, for example, I was able to sort of take a look at how much nitrous oxide we had purchased at my hospital over the previous 5 years. And then I was able to take the nitrous oxide in terms of number of kilograms and actually plug it into this tool. And we were able to determine that our 5-year usage of nitrous oxide was the equivalent of driving 38 million kilometers.
Wow.
And what it would take to offset that would be to plant 160,600 trees at a seedling level and allow them to grow for 10 years in order to offset our 5-year carbon footprint associated with nitrous oxide alone. And so, not to diminish the trees that Myles is planting, but I need to work with my teams on that nitrous oxide so that his trees can get ahead of things.
Right. And reverse some of the damage that we have done in the previous years, right?
And stop that going forward. But it is complicated to move that project forward. There's lots of moving parts. Nitrous oxide doesn't belong to pharmacy. I just happened to, it's a clinically used gas. But the plant operations and maintenance are the key players. So they're really leading and supporting us and our vendors and et cetera. But so luckily they're very, very supportive and great to work with.
That's amazing to hear, because actually that was one of my next questions for the both of you was, you're really pioneering some of this work. To be honest, when I was doing research into this, we are not seeing or hearing a lot about these initiatives, maybe because they're happening within organizations. Maybe there's just not enough in terms of resources that are available out to kind of, convey the impact that you're able to achieve through this work that you're leading. How difficult is it to, get this work started, get this conversation started in the first place, and then to kind of lead it to the level of work that you're currently doing with it, because you've been able to achieve significant impact, but I'm sure it was not something that happened overnight. If you were to kind of elaborate on that, again, this is more to help folks like us who are trying to implement changes within our own organizations to kind of give a realistic picture of what we can accomplish and how long it might take us to do that.
Mm-hmm. I would say that the Peach project, again, not quite 2 years, has done better than I expected. And it is because people are aware now.
Right.
And people are energized and people want to do things. And it was just maybe a little before 2 years ago, when I was doing some of my tree presentations, that I would talk about climate change and give some slides to try to sell the fact that climate change is a real thing. I don't even really do that anymore. I think that people know it's a problem. There was a study done in, I believe it was the UHN, University Health Network System, by Fiona Miller, looking at 1,600 employees that answered this questionnaire about, do you think environmental sustainability is important? Do you want your management to be doing more? And something like 95% of people said, either strongly yes or yes, or, so I don't feel like we need to sell this anymore, especially within healthcare. I think people know this is a big problem. People want to act.
Right.
So that was the first thing. What we did at Peach, for a couple of reasons. From the very outset, we knew there were some what I would call climate superstars out there in the province, and Ontario, of course, is a big province. And so we found out who they were, and we reached out to them, and almost all of them were happy to talk. What are you doing in your organization that makes you a superstar? I'll throw out a few. Marianne Katusin, a food manager at Oakville Trafalgar, doing all kinds of amazing things around food. If you were to take that and blow it up to the whole province, it makes an impact.
Right.
A lot of the facility stuff, Ed Rubenstein leads a big team at UHN, but they've been doing this stuff for 20 years. So we spoke to Ed. I could go, down the list, a lot of people. Some clinicians, some not clinicians. And then we told their stories on the Peach website. And again, I just think if you could take all those different areas, because there's a lot of areas within a health facility. There's obviously the engineering thing, which is the first thing you think of, with the boiler room and the LED lights. But again, there's food, there's transportation, there's leadership is arguably the biggest one of all. if you could have a superstar hospital that had everything going on, you'd be approaching the ideal green facility, right? So that's kind of the approach we've taken. And so Peach, the idea, the vision was to create the ideal green facility and help people get there. We just had a lot of uptake. People seem to be ready for this. And then the coalition, I started as the ED there in February. The vision there is how to create the ideal green community. And the idea there is the fact that we know that health professionals are trusted people in the community.
Yep.
Have leadership voices in the community. And so we need to be shouting this out, right? I'm sure pharmacists must be higher than docs. There's too many docs out there in the media that do bad things that kind of drop our rating, right? I don't see many bad pharmacists out there. Anyway, we have a trusted voice. We need to tell other parts of the community that we're doing this. I tell boards or executive directors of hospitals that are doing great things and don't talk about it. You need to put that on your banner. This is one of our pillars. Look at all these great things we're doing. So that's one thing. And then the other part of the hospitals or health facilities and healthcare leading is the fact that we interact with so many parts of society. We interact with government. We interact with universities. We interact with manufacturers. I'm going to stop there because I could keep going and going. But if you want to, it's the manufacturing piece, which is arguably the biggest piece. And Danette and I are both doing things on that end. And I'll hand it over to Danette. We probably even forgot what the question was. What was the question?
The question was, how do we get started if somebody's looking to implement sustainability initiatives within their organizations, in healthcare organizations?
Yeah, and I think the main thing to keep in mind is you don't need to reinvent the wheel. You can go to that Peach website, and all of those resources are there. And people are delighted. Reach out. People are delighted to share, because those people who are doing this work, they are excited about it. They're passionate about sharing it. And I have to be honest with you, the taxpayer has paid for this work once. They should not have to pay for it again.
Agreed.
And so I feel very, very strongly about the responsible stewardship of taxpayers' dollars. I think it's really an important responsibility. When it comes to pharmaceuticals, they do contribute about 26% of the sort of carbon footprint, but a lot of that carbon footprint is harder to capture, and it has a lot to do with the manufacturing process or the transportation processes. And so they talk about what is directly within your control and what is sort of peripherally within your influence. And so you can select greener options. We Myles and I have both been working with some of the group purchasing organizations, and those group purchasing organizations, so Health Pro and Mohawk have started to introduce requirements within their RFP, so their bid and tender process, to require or vendors to actually include their carbon footprint track record of their company, not so much of each individual product, because that's harder to measure and harder to track and harder to validate. But they've been very receptive to adding that to their requirements on doing purchasing as well. And so when it comes to hospitals, that purchasing piece, we select drugs on our formulary.
Right.
And so we can select more appropriate options, like ensuring that there are good options to metered dose inhalers on your formulary.
Right.
And that it is still available, though, for those patients who require it and don't have other options or other appropriate options. And but then the group purchasing organizations, that purchasing piece, that is an important piece around these are Health Pros National, and Mohawk Medbuy is very strong in a couple of provinces, and they are really pivotal in having large pharmaceutical companies move that lever. And then it comes to, so then how do we get organizations like Walmart pharmacies and Shoppers Drug Mart, and maybe I shouldn't be naming them because there are so many, and I'll leave some out, and people will think I'm picking on Walmart, and I'm not. Just large pharmaceutical chains to also add those types of requirements in their procurement processes as well. And then there are other smaller things you can do as well. And this is something that we've been working on. So we've been working with lean processes. And so one of my pharmacy managers she's amazing. But in the interest of reducing workload and busy work, we really look at, do we need to order that particular drug 4 times a month? Or could we perhaps order it once a month? Do we have enough place to stock it? And therefore, we're not constantly, doing all of the processes associated with receiving invoices, transportation, etc., which creates a lot of work within the organization. Every piece of work actually does have a carbon footprint, because there is a carbon footprint associated with emails and e-transfers and all of those other activities as well. And so these are some of the things that you can do that actually very popular with your staff, because there's a lot less busy work, and actually can have an impact as well. So some things we can influence and some things we can change.
That's amazing. Thank you for guiding that, because, even something as simple, we may think something as simple as procurement, but it has such a big impact, like in terms of like the amplification and the waves that it creates as a result of one simple decision of, am I ordering 500 milligram tablets today versus ordering a bulk of 1,000 and not having to do this order again for another month or a month and a half. That's thank you so much for sharing that. And I think that kind of leads me to my second question, in terms of like as a healthcare provider myself, and, having the honor to have the both of you from different perspectives and the lenses that you bring, what can healthcare providers on an individual level do to kind of help, join this movement and create an impact, raising awareness? As Myles mentioned, the awareness exists to a certain level, but what is it that we can do better as healthcare providers to make sure that we are able to play our part in minimizing whatever impact, negative impact we may be having on the climate? It's a very broad question, but I'll just would love to hear your insights on this.
Yeah. So Myles, I think you had some perspectives on prescribing, and I have some as well. So if you want to start, you talked about the reducing 1 in 20 meds.
The deprescribing.
Yeah, that just happens to be the 5% number. And I am a family doc, but all of the work I do at this point in my career is inpatient medicine. So at a complex or chronic care hospital, and at an inpatient addiction facility for men. So that's, more clinic style. But we just made or updated the Green Office Toolkit. So the Green Office Toolkit came out originally in 2018, done by the coalition. I was not part of the coalition at the time. It was a different group. And it's been 5 years since the original one was put out. This is on the Canadian Coalition for Green Healthcare website. We left the original one up there, and we updated it. And I'd been asking the Ontario College of Family Physicians, could they do some stuff around sustainability? And I've been sort of knocking on that door for a while. And then I finally got the sort of the green light. Yes, could you update the Green Office Toolkit in time for Earth Day, which basically left us less than a month, and you'll see what we did in a month. I felt like a university student doing all-nighters. But we basically reached out to people all across the country to do an update and to write, call them chapters, they're really one-pagers, on all the different things you can do within a clinic. I'll also give a shout out to Cascades. We work a lot with the Cascades organization, and Jamie Park, who's a pharmacist, just recently made that document. Danette and I both made some edits to it. What is it called, Danette? But it'd be on the Cascades website, the pharmacy tool.
Yeah, it was the pharmacy tool. Yeah.
For pharmacists, right? Yeah.
Yeah.
But yeah, you could certainly look at the Green Office Toolkit. If you're working in a hospital, we have both on the Peach website and the Coalition website, the guidebook for leaders within hospitals, and that sort of shows. I think what people like the best there is our page, a double-sided page with check boxes, and there's 22 check boxes. It's essentially a Pareto analysis. If you think of all the different things you could do, I mean, at a clinic or at a hospital, all the different things you could do as an initiative. And people usually want to start with recycling. That's kind of the go-to thing. Or maybe they want to get EV chargers for their clinic.
Right.
But there are bigger fish to fry. And so we listed those on our hospital toolkit. There's 22 items, which we feel are the biggest ones to go after. And they include, of course, going back to trees, planting trees. It includes pharmacy, and deprescribing is maybe the biggest thing you can do within pharmacy. Gosh, I could go on and on. The interesting thing about, you think, why are pharmaceuticals so harmful, and why are they 26%? And most of that 26% is not in the emissions like the anesthetic gases we're talking about. It's in the production. Yeah. And you need the APIs of a medication, the active pharmaceutical ingredients, and you need the excipients. They don't teach you about that in medical school. They teach you about that in pharmacy school. They probably do.
They do.
Okay, they do. Okay, fair enough. Okay, so excipients was kind of a new idea. Oh, excipients are in there too.
Yes.
And so I actually picking on lorazepam right now with a group of engineer master's students from McMaster. And we're doing a project called The Journey of a Pill. We're almost finished. And we're sort of looking at the process a pill goes through. And it starts with being dug out of the ground. And it's not just the APIs. It's all the excipients. And it's usually in Asia, different parts of Asia. Then it's shipped to Europe for manufacturing. And that's a black box. I liken it to Willy Wonka's chocolate factory, because no one goes in there and no one sees what's really going on. So we don't know the carbon footprint of that process. Then it gets shipped usually to Ireland or the States for packaging. Then it comes to Canada. Then we use it in the pharmacy, or hopefully we use it and it hasn't expired and we didn't throw it out. So, I mean, that is the linear economy, from digging things out of the ground to manufacturing, packaging, using, throwing out. And that's the tough thing about meds. What is the circular economy for meds? You can have a circular economy for gowns. You can have throwaway gowns, which are bad. You can have washable gowns, which go back and circle into the system, right?
Yes.
What do you do about meds? I mean, one thing is we need to look at the process, right? We need to call out those pharmaceutical companies, and some of them are trying really hard. How do we make it better? How is there less greenhouse gases that go into making that little pill? But the one thing we can do as prescribers is really think, look, we've been overprescribing for years. We know that it's bad for patients, it's bad for the health system, and now we know it's bad for the planet. And that is the group that Danette and I co-chair, the Sustainable Prescribing National Working Group, which is all the deprescribing networks in Canada, putting a green lens on this.
That's fantastic. Thank you very much, Myles. And Danette, I'd love to hear your thoughts on that.
Yeah, so I am a hospital pharmacist, but when you again, I think about it from the system perspective. So Myles, definitely, I agree. Like, as each patient is considered as an individual, and you look at, do you really need that? Do you really need that? Do you really need that? If you think back to maybe, I don't know, 10 years ago, we all had docusate sodium on our hospital formularies, and all these patients were on it, and it was useless.
Yep.
Right? And so most hospital formularies have removed that from, it's just not available anymore. And so I actually am a big believer in removing useless medications and setting up systems. And then you don't teach today's medical residents to prescribe it, because it's on a pre-printed order or a CPOE order set. And they automatically check it off, or sometimes it was already checked off. And you didn't even have to check it off. You'd have to scratch it out if you didn't want it. I think that those are the things that, we need to think about as well. What can we do as a system in terms of getting rid of those things that are just plain useless, and we know they're useless? Acyclovir ointment.
Yes.
It's useless. It's no better than Vaseline. And it is still available on the Canadian market. Right? It shouldn't be on formulary. It's not at Sunnybrook. but it shouldn't be on anybody's formulary. It doesn't work. Give something that works at least. Is safe and effective. And so you need the individualized attention to seeing each patient as an individual. You need systems and processes so that medications do get optimized, and they rarely get optimized in a hospital. Yes. And the reason for that is that hospitals are fix-it places, right? Like when you bring your car in because it's broken down, they don't generally, do a maintenance check on it as well. They will just fix what's broken today, get you on the road, and you have to come back for a maintenance check to your primary care physician. But primary care physicians are sometimes hesitant to change chronic meds that were added by a specialist, that the patient was in the hospital a month ago and the specialist didn't stop it, or change it. And so the question is, how do we break down those barriers and implement systems that optimize medication for patients on an individual basis, as well as on a systems-based perspective? So we need that double-pronged approach where we do those high leverage forcing functions.
Yes.
And then we need that high quality care that is truly patient centric. And when you think about the patient, the environment that the patient lives in is a big indicator of their health. We know that people who live in an environment with more green space and clean water, they have higher social determinants of health and environmental determinants of health. And so if you're thinking of the patient in that perspective, then reducing unnecessary medications, and that said, medications are very cost effective as well. Preventative medication is often the very best. So getting your breast cancer screening, getting your pap test, your colon cancer screening, and then catching things early or before they even become cancers, we know that improves survival. It's the best thing for patients. When you think of all that chemotherapy that we're not giving later, and all of the plastic that goes with that and all of the PPE, that's very impactful. So I will say that primary care is so poised to have such a huge impact on the environment, on the health of patients, in many ways, including their environmental surroundings.
Absolutely. And wow, I think I've just been mind blown this entire conversation, to be honest, because you've given me a new perspective to looking at prevention. Before, prevention was more of, it's your health, you're taking care of it, or it's a more cost-effective way of living because, you're not.
And it is.
It is, absolutely, but it's also a sustainable way of living, like who would have seen it that way? I definitely did not see it that way until just now. So thank you very much for changing that. And I agree, I definitely feel like, a lot of work needs to be done at the community level for sure. We are doing some, from the work that you're leading at hospitals and healthcare organizations, that's great. But I think we need to translate that work into the community. And often, with the trend that we're seeing now, where we have more categories of prescribers emerging into the market, right? Like if we were to look at healthcare as a market, now we have nurse practitioners, we have pharmacists who are also able to prescribe to a certain extent, and this is where de-prescribing conversations can have such a huge impact. We still sell DocuSate sodium, so it's not like it's off the community pharmacy shelf; it's still there, and we still get prescriptions for DocuSate sodium, so that's still happening, even though we know the evidence is just not there, like in terms of its effectiveness, just being pretty much the same as placebo. So it's this is why I'm hoping that these kind of conversations will raise that awareness and will force us to think a little differently when we're seeing that next prescription on our table, to really assess it and be like, is this really the best thing for the patient? Can we do something better? And I think what you shared today, it really hits that point, because it really will force us to rethink, should I be having a conversation with my patient eating more fiber than the docetates sodium. I think that might do much more benefit to the patient. But as we're wrapping up this conversation, just a couple more questions just to get your insights on this. One of the things I always like to ask my guests who come onto this podcast is, as leaders who are doing incredible work in your own spaces, how do you envision sustainability kind of taking a role in healthcare organizations in the next 5 to 10 years? What kind of initiatives or, what can we expect from the work that you're leading in the next 5 to 10 years?
Well, certainly. So I'm at Hamilton Health Sciences, which added sustainability as a fourth pillar 6 months ago, which I was very happy about, and I'm on that green team. And before we forget, if you are a pharmacist, make sure that your corporate green team has a pharmacist on it. Pharmacy needs to be. Again, that's 25%. So pharmacists have a massive role to play. So in the years to come, hopefully this becomes standard, that every hospital, long-term care, clinic, obviously you can have leadership within clinics, has a green team. This becomes part of the culture. This is on every agenda. And then we can start sort of raising the bar to what are the things we can do. And we also need to work with industry, and that's a huge one. And I'm sorry, I don't remember if I mentioned the whole thing about supply chain and procurement. Is that study in England did show that supply chain or procurement is 62% of the entire puzzle. So that's the big piece. Wow. Where pharmacy was 22%, but then you have the other medical devices, 62%. A study just done in Laval in the last year suggested it is as much as 90%. And there's other studies that have been done, Aga Khan, putting it in the 70-75% range. So the stuff we buy is just massive. So in the years to come, we need to get those ideas across. And as part of it, we need to push our suppliers to make greener products. And this is where I actually have hope, because if there are rating systems to rate which companies make the greenest products. And so we can look that up from an industry perspective, like from where we work, and we can look it up in our personal lives and decide which type of shoes we want to buy. And one of the biggest ones is Science-Based Targets Initiative, SBTI. They've been around for a long time. There's a bunch of them like that are not for profits that rate companies. This is where we need to go. And I was at or a conference yesterday that did have industry there. And it's interesting because I remember as a medical student at McMaster in the early 90s being told, do not interact with industry, do not interact with big pharma. It's a conflict of interest. And that's laughing. But, I took it seriously. I did not see pharmacy reps for years and years because I thought I should be making decisions based on the evidence alone and not based on what a clever person is telling me at my desk about a certain product, because I'm buying it on behalf of the patient or right promoting it. But now I'm doing a 180, because if we're going to solve this massive problem, we have to work with industry.
Yes.
So that's my message. We have to work with industry. We have to believe that industry is coming along with us and that they care about their kids and their grandkids, et cetera, right?
Absolutely. I think that integration, I think we need to break down our silos in terms of our own practice environments and kind of integrate all the different, players within the healthcare industries to come together on that same table and have those conversations. But I would love to also hear what Danette has to say to that about this.
Yeah, I think I'm not so great at figuring out the where are we going in the future. I think I'm probably more of a next 3 years person, and I think that we're going to see some exciting change. I really hope we'll be seeing some exciting change, and I think that we're at a time right now where things are truly pivotal, and I also think that we need to keep in mind that money talks.
Yes.
And so the reason that you still are dispensing docusate sodium is because people are still prescribing it. And the reason that's still being made is because it's still being prescribed.
Yes.
And so we need to keep in mind that pharmaceutical companies are profit driven. And their mission is to have the best return on investment for their shareholders. And so we need to ensure that we do everything we can to make sure that the only way you're going to get a good return on investment for your shareholders is if you're not poisoning the environment, and if you're actually cleaning it and fixing the problem. And so I think that that's very important, and I think it's part of our responsibility. I'm not saying that pharmaceutical industry wouldn't do this just because it's the right thing to do, but we can make them do it faster if it's the profitable thing to do.
Absolutely. Wow.
That's so cynical, I know, but it's
I would really think of that as a direction in terms of, where we are heading into the future. And I really do hope, the visions that you have both described, that would come into existence sooner rather than later, because we all know the urgency around, climate change and sustainability. We know how important and urgent these issues are to not just the planet, but also for human health in general too. Like, we know the impact that, global warming has on our own health systems as well. So I think the tidbits that you've shared today, the expert insights that you've shared with us today, I think this is really, to be honest, not that this is because we're having this conversation here today, but I really don't think we have talked about these various aspects of it in a way where it becomes relatable to a healthcare practitioner. And I'm really hoping that this episode will kind of light that light bulb in each of our minds to be like, okay, you know what? I need to question this. I need to think about this before I decide to even prescribe this. I also need to talk to my pharmacy rep that comes to visit me to be like, hey, what are you doing about this, right? Until we're able to achieve that circular economy for a pill, which, I'm not sure when we'll have an answer to that. But until we reach that stage, having these conversations will really help us. And I think as my final question to the both of you, as we wrap up this conversation is, so if somebody was very interested, like someone like myself, who's very interested in trying to see what can I do to make a difference, and, how can I get involved? One advice, as a parting advice that you would give as we wrap up this episode, of, where to get started, what resources, anything that you wish to highlight as a concluding thought today.
So I'm going to say perfection is the enemy of progress. Just start. Start where you are. Just start.
Thank you. Thank you, Danette.
Myles?
Yeah, I would say you should make a podcast about it.
I think that's a good idea.
Yeah, no, look, I agree with I agree with Danette. I think that's a really good point. Like, you can look at what your perfect life might be, but you might not want to live in that small house or whatnot, right? So just take every step you can. There are some great things you can Google. There's this one that I've come across with 101 things you can do for climate change or something like that. The 101 was the key number. It talks about what you can do in your home, what you can do in your street, what you can do in your community, what you can do in your city, depending on how big you want to get with it. And I suppose the one thing, again, because supply chain is so big, and because pharmacists make so much money, we need to think about how we buy things as well, right? In our personal lives, not just at work.
Absolutely. And thank you very much to the both of you. Thank you so much. This was such a mind-boggling conversation, in the sense that, I learned such important, facts that I did not know about, little things that we don't even think about. Procurement. Who thought procurement had such a rippling effect? Who thought prescribing one medication had such a big impact? These are the kind of questions that I'm really hoping that, we'll be able to have you both back on, and, to kind of continue these conversations into the future. Because I really feel like one conversation does not do justice to this. And the work that you have both been leading respectively has been incredible. And I think we have only peeled one layer, if I could even say that, of that, but there's much more to learn, from the work that you have done. And, as we wrap up this conversation, if somebody was to get in touch with you, what would be the best way to reach out to you?
So for me, it's email. So you feel free to publish my email. That's fine. And thank you very much for having me on here today.
Thank you so much, Danette.
Same email, Myles@greenhealth.ca.
Awesome. And I'll be sure to link all of the resources and the guides that you have spoken about today in the description box, as well as we'll have our little banner come through so that anyone who's looking for these resources will have them, and we'll make sure to also include your email addresses and any other social media profiles you want us to include. We'll definitely make sure that it's there so that anyone can reach out to you to kind of, gain and learn from that. But thank you both so much for, making this time to have this conversation with me. I'm so grateful. And it was my pleasure to have the both of you here today. Thank you.
Thank you so much. You have a great day.
Thank you.
Thanks, Aska. Nice
awesome.
to see you.
Yeah.
Okay, bye-bye. Until next time. Bye-bye. Before we move forward, I just want to also acknowledge Ecolofarm for being our sponsor for the series where we'll be speaking about sustainability in healthcare and in pharmacy. Ecolofarm is a leader in sustainable development. Ecolofarm was the first company to offer pharmacies eco-friendly packaging products for dispensing medications. Their expertise consists in designing and manufacturing the most innovative, sustainable, and eco-friendly packaging solutions in order to help pharmacies reduce their environmental impact. So make sure Ecolofarm has always stood for innovative packaging for a greener future, and we could not be asked for a better partner for the series, as Ecolofarm truly walks the talk and has been a pioneer in the space of creating green pharmacy solutions. It gives us an immense pleasure to be able to partner with Ecolofarm to bring forward the series to you. And I hope you enjoy the series and learn from it, and hopefully implement some of the solutions we discuss here, as it will truly help our planet, especially curb climate change and make sure that we're able to leave a greener planet for our future generations. All right, and that's a wrap for our episode today. Thank you very much for joining us. Make sure to check out our description box below for all of the links to the resources that we spoke about today, and make sure to check them out, because you just never know what that first project in sustainability you might be putting on tomorrow as you go back to your workplace. Would love to always hear your comments and feedback on what you thought about the episode, and any other suggestions and recommendations you may have. Please feel free to drop them down below. And last but not least, please subscribe and please like so that we know that you enjoyed this content. All right, till next time. Bye-bye.